So now we are going to discuss Sympatholytics classification. So Sympatholytics, also known as adrenergic antagonists, or it is also called adrenergic blockers, or a class of drugs that inhibit the actions of sympathetic nervous system. And the sympathetic nervous system is responsible for the fight or flight response and regulates various bodily functions such as heart rate, blood pressure, and pupil dilation, as I have already discussed in the previous lecture. Now, sympatholytics. So the sympatholytics basically work on alpha and beta receptors, and unlike the sympathomimetic drugs, which stimulate them, they block these receptors. So they are also called alpha blockers and beta blockers. Now, the alpha blockers can be divided into three types: non-selective, selective alpha-1 blockers, and selective alpha-2 blockers. Now, the non-selective alpha blockers can be further divided into two types: reversible and irreversible antagonist. Now, the reversible antagonist meaning that the drug can bind to the alpha blocker reversibly, while the irreversible meaning that the drug can bind to the alpha blockers irreversibly, like it can transit it back and leave the receptor. Now, the reversible drugs are tolazoline and phentolamine, while the irreversible is phenoxybenzamine. Now, basically what they do is they block the alpha receptor, and the action of the adrenaline will not be there because the alpha receptors are preoccupied by reversible or irreversible blockers. Now let's discuss all of these terms in more detail. Now basically, what alpha receptors do is they are present in the smooth muscles of the vessels, and they promote vasoconstriction. Now, what the non-selective alpha blockers do is they block the alpha receptors and cause vasodilatation. Now, because of the vasodilatation, what it occurs, the patient goes on the postural hypotension, which means the reduced blood pressure. Now, let's discuss what is postural hypotension. So, the postural hypotension is the dropping of the blood pressure when the individual in the supine position gets to the upright standing position. Now, why this does is because the vasodilatation is occurring and the blood pressure is already dropping because of the antagonism of the alpha-1 receptors. Now, we have seen that there are two types of alpha receptors, alpha-1 receptors, and then we have alpha-2 receptors. Now, alpha-1 receptors are present in smooth muscles and they promote vasoconstriction of the vessel. Now, alpha-2 receptors are present in the CNS, central nervous system, and they basically decrease the sympathetic discharge and decrease the sympathetic outflow. Now, note here that when alpha-2 receptors are stimulated, they decrease the sympathetic discharge. Now, what happens when the alpha-2 receptors are blocked? They increase the sympathetic discharge, which promotes to the marked tachycardia. Now, the tachycardia refers to a fast, resting heart rate. Heart is in the resting state, but it is beating over 100 beats per minute in adults. Now, some people have no symptoms, but they may notice, palpitations, lightheadedness, and other changes. So we already discussed that alpha-2 receptors promote marked tachycardia. Next is the clinical uses. Now, the non-selective alpha blockers may cause vasomotor reversal of tail. Now, what is the vasomotor reversal of tail? So, the adrenaline basically acts on alpha-1 receptors, and also it acts on beta-2 receptors. Now, adrenaline, when acting on alpha-1 receptor, it promotes vasoconstriction, while the adrenaline, when acting on beta-2 receptor, it promotes vasodilatation. Now, note here that you have given alpha blocker, so alpha-1 receptor is completely blocked and no vasoconstriction is happening, and ultimately no blood pressure rise, which is denoted by this bulge here. Now, this is the rise in the blood pressure due to the alpha-1 receptor, and then this is the vasodilatation and the decrease in the blood pressure due to beta-2 receptor. Now, when you are giving the alpha blocker first, it blocks the alpha receptor, and then you're giving the adrenaline. Now, it promotes vasodilatation, but the alpha receptor is blocked. So this dilatation is known as vasomotor reversal of the tail. Again, I'll repeat for your understanding. Now, you have given non-selective alpha blocker, and non-selective alpha blocker basically acts on both receptors, alpha 1 and alpha 2. Now, the alpha 1 receptor action is the vasoconstriction, which is the rise in the blood pressure, which is denoted by this bulge here. While the adrenaline, then you have given the adrenaline. Now, adrenaline, what it does is it acts on the beta 2 receptor and it promotes vasodilatation, and it is denoted by this degradation of the curve, and this is vasodilatation. Now, when alpha 1 receptor is diminished, only the dilatation is seen, which is known as the vasomotor reversal of tail. So hope you'll understand it. Next, we are going to move towards the clinical uses of the alpha non-selective blockers. First, let me revise all of those concepts for you. So we have sympatholytics. Sympatholytics meaning that they block the alpha and beta receptors, unlike the sympathomimetics, which stimulate them. That is why they are called alpha blockers and beta blockers. They are divided into non-selective and selective alpha 1 and selective alpha 2 blockers. Right now, we have discussed non-selective alpha blockers, which are reversible and irreversible antagonists. So reversible antagonists meaning that they bind reversibly to the alpha blockers, to the alpha receptors, while the irreversible meaning that they bind irreversibly to the alpha receptors. Reversible examples we have is tolazoline and phentolamine, which we will discuss further, and the irreversible is phenoxybenzamine. Again, we have discussed what are the physiological functions of the alpha receptors. So the alpha 1 receptor promote vasoconstriction, and the alpha 2 receptor, which we discussed here. Alpha 2 receptor, which we discussed here, promote sympathetic, decrease the sympathetic discharge. So the alpha 1 receptors are present in the smooth muscles of the vessels, and they promote vasoconstriction. You block them, vasodilatation happens, and it promotes postural hypotension. While the alpha 2 receptors are present in the CNS, central nervous system, and they decrease the sympathetic discharge. You block alpha 2 receptors, they promote marked tachycardia, which is rise in the 100 beats per minute heart rate. Now, then we have discussed the vasomotor reversal of the tail, which is basically if you give alpha blockers prior to the adrenaline. Now, alpha blockers, what they do is they promote vasoconstriction, and vasoconstriction is blocked, so there is only vasodilatation happening. So it causes the decrease in the blood pressure, fall in the blood pressure, prolonged fall. You can also say that it is the prolonged fall of the blood pressure, and it is known as vasomotor reversal of the tail. Next, we are going to discuss clinical uses. So now we will discuss phenoxybenzamine. So phenoxybenzamine, as I have already shown you on the classification slide, that it is a reversible non-selective alpha blocker. So phenoxamine is used to prevent hypertensive episodes. Now, hypertensive episodes in what? In the operative manipulation of the tumor in pheochromocytoma. Now, what is pheochromocytoma? Pheochromocytoma is basically a tumor originating from chromaffin cells of the adrenal medulla. Now, it basically causes the excess amount of norepinephrine and epinephrine and increases the blood pressure. Now, the only treatment of choice for the pheochromocytoma is the surgical resection of the tumor. Now, when you are manipulating the tumor, what it does is, it basically creates a risk of the spillage of the norepinephrine and epinephrine into the plasma. Now, when the norepinephrine and epinephrine is spilled into the plasma, it increases the blood pressure during surgery, and it is known as the hypertensive episodes. Now, phenoxybenzamine, as you know, is non-selective alpha blocker. So it blocks alpha receptors and decreases the blood pressure and prevent hypertensive episodes. I repeat, phenoxybenzamine is basically used to prevent hypertensive episodes in operative manipulation of the tumor in pheochromocytoma. Pheochromocytoma is the tumor on the adrenal medulla. When you remove it, there is a risk of the spillage of the norepinephrine and epinephrine into the plasma, which causes a rise in the blood pressure, and therefore we use phenoxybenzamine to prevent it. Next, we have is phentolamine and tolazoline. So the phentolamine and tolazoline is used in the hypertensive crisis in clonidine withdrawal and cheese reaction. So what is clonidine withdrawal and cheese reaction, which we will discuss it shortly. So phentolamine and tolazoline, you remember they are the reversible non-selective alpha blockers. So they are reversible non-selective alpha-2 blockers basically. Now clonidine is a medication that acts on alpha-2 adrenergic receptor, which leads to a reduction in the blood pressure and other effects. Now when clonidine is abruptly discontinued, which is known as the withdrawal symptoms, now it can result in high blood pressure, anxiety, agitation, tremors, rapid heartbeat, sweating and headache, basically alpha-2 adrenergic stimulation effects. Now we give phentolamine and tolazoline to block the alpha-2 adrenergic receptor. Now when alpha-2 adrenergic receptor is blocked, hypertensive crisis diminishes. Now in the cheese reaction, and the mechanism is same. So in the cheese reaction is basically refers to a potentially dangerous interaction between certain medications and foods that contain high levels of tyramine. Now tyramine is present in the cheese. Now, when tyramine levels become too high, it causes increase in the release of norepinephrine, which is a neurotransmitter that regulates blood pressure. So the blood pressure is rising, which is promoting of hypertensive crisis. Now, phentolamine and tolazoline we give in cheese reaction to decrease the blood pressure. Now again, let me repeat that. Phentolamine and tolazoline, they both are alpha-2 adrenergic blockers. Clonidine is the alpha-2 adrenergic stimulator. Now clonidine, what it does is it increases clonidine withdrawal, basically increases the high blood pressure. To counter that, we give phentolamine and tolazoline. In the cheese reaction, in cheese, tyramine is present. Now, tyramine increases the neurotransmitter norepinephrine. The norepinephrine also increases the blood pressure and promotes hypertensive crisis. Now, to deal that a hypertensive crisis, we give phentolamine and tolazoline. Next, we are going to move towards selective alpha-1 blockers. So the selective alpha-1 blocker is used to block only alpha-1 receptor and not alpha-2 receptor. Now, what is the function of alpha-1 receptor? It basically, when it gets stimulated, it increases the blood pressure. Already discussed, it causes vasoconstriction. And when it is blocked, it decreases the blood pressure. Now, note here, the selective alpha-1 blocker causes lesser tachycardia than non-selective alpha blockers. Why? You remember it? Non-selective alpha blocker basically act on both alpha-1 and alpha-2. And we already discussed, let me show you, that alpha-2 promotes tachycardia. Now, alpha-2 receptor, when it is blocked, it increases the sympathetic discharge and it promotes marked tachycardia. Now, the advantage of giving only the alpha-1 receptor, selective alpha-1 receptor blocker is it decreases the blood pressure, it causes the vasodilatation, but marked tachycardia is not happening, which is the effect of alpha-2 receptor. So, that is the only reason that we use selective alpha-1 blocker, because they have advantage that they promote lesser tachycardia than non-selective alpha blockers. Now, selective alpha-1 blockers include pyrazosine, trazosine, doxazosine, and alfuzosin. Why we use selective alpha-1 blockers? Because they promote lesser tachycardia, and we are only targeting alpha-1 receptor and not alpha-2 receptor. Next, it promotes favorable effect on lipid profile. How? So it promotes HDL, which is high density lipoprotein and is considered good cholesterol, and it decreases the bad cholesterol, which is low density lipoprotein or LDL, and triglycerides. Now, why HDL is considered good cholesterol? Because it is following the reversible cholesterol transport. Now, what is reversible cholesterol transport? Through which the cholesterol is taken out from the periphery and is supplied to the liver, which is then gets metabolized. So HDL is good cholesterol because it is getting metabolized. Next is, now we will discuss selective alpha-1A subtype. Now, selective alpha-1A subtype is the descendant of the selective alpha-1 blocker, and it includes tamsulosin and silodosin, which is used in the benign prostatic hyperplasia. Now, benign prostatic hyperplasia also known as benign prostatic enlargement, is a non-cancerous condition that affects the prostate gland in men. So basically, the prostate gland is located below the bladder and it surrounds the urethra, which carries urine from the bladder out of the body. Note here that I have discussed that it is located, there are two organs are involved, urinary bladder and prostatic urethra. Now, let me discuss. Remember, alpha-1 receptor is present in the smooth muscle, and blocking it causes smooth muscle relaxation, already discussed. Now, when we block this alpha-1 receptor, it causes smooth muscle relaxation in the neck of the urinary bladder and in the prostatic urethra. Now, when the relaxation happens in both these urinary bladder and prostatic urethra, it improves the urinary flow. Now, this advantageous effect of improving the urinary flow promotes the relief in benign prostatic hyperplasia. Now, again, we block the alpha-1 receptor. It causes smooth muscle relaxation in the urinary bladder and prostatic urethra. It improves the urinary flow, and due to this, it is the drug of choice, tamsulosin and silodosin, in benign prostatic hyperplasia. Next, we have is selective alpha-1 blockers adverse effects or adverse reactions. Now, the prazosin cause postural hypotension, which we already discussed, is due to alpha-1 receptor blockade, and within first few doses, it causes postural hypotension, and also known as first dose effect. But if used continuously, like if we use continuously prazosin or terazosin, tolerance develops and postural hypotension don't occurs. Now, what we will do to prevent the postural hypotension, we already discussed, we use alpha-1A subtype. Now, alpha-1A subtype, tamsulosin or silodosin, don't have any effect on blood vessels, smooth muscles of the blood vessels, so they don't cause postural hypotension, but they also have some inner side effects also. So they cause floppy iris syndrome during cataract surgery. So what is floppy iris syndrome? It's basically, it is a flaccid iris which comes near during the cataract surgery. So tamsulosin and silodosin also has some adverse reactions. Now, selective alpha-1 blockers also cause ejaculation disorders, and they also cause fatigue and drowsiness, gastrointestinal effects, and edema, which is the swelling of the limbs like feet and hands. Next, we move on towards selective alpha-2 blockers. Now, selective alpha-2 blockers, also known as selective alpha-2 adrenergic antagonist, are a class of medication that specifically block alpha-2 adrenergic receptors. Now, these receptors are found in the various tissues and organs, including central nervous system, where it acts on the presynaptic neuron, and blood vessels and smooth muscles. Now, by blocking alpha-2 adrenergic receptors, selective alpha-2 blockers interfere with the normal functioning of the norepinephrine. Now, norepinephrine, you already discussed, a neurotransmitter involved in the regulation of normal physiological processes. Now, by doing so, these medications can have various effects depending on the specific receptor subtype they target and the tissues involved. Now, the selective alpha-2 blockers are primarily used in the treatment of hypertension, high blood pressure, and certain other conditions. Now, let's discuss the first one, which is euhimbine. Now, euhimbine is a naturally occurring alkaloid which is derived from the bark of African euhimbine tree. Now, it acts as the alpha-2 blocker and is mainly used for the treatment of erectile dysfunction. Now, it works by enhancing the release of norepinephrine and, enhancing the release of norepinephrine and improve, because the norepinephrine is released, blood flow is improved, so the erectile dysfunction diminishes. The penis gets constant supply of the blood flow. Next we use is mirtazapine. Now, mirtazapine is used as an antidepressant, but it also acts as selective alpha-2 blocker. So what it does is it increases the serotonin and norepinephrine in the brain, which helps alleviate depression symptoms. So because serotonin is like it produces a reward mechanism, so it gets you euphoria. So additionally, its alpha-2 blocking properties contributes to its sedative effects, making it useful for the insomnia. So it causes sedation, whereas atipamezole is used for the reversal of sedation. Now note here that mirtazapine causes sedation and is used for insomnia, while atipamezole is used for the reversal of the sedation. Now what is atipamezole? Atipamezole is a veterinary medication used as a specific antidote for the reversal of the sedation and anesthesia caused by certain alpha-2 agonists. Now what are those alpha-2 agonists? They are metidobadine and dexmetidobadine. So metidobadine and dexmetidobadine is used as alpha-2 agonist, and they cause sedation, and if you want to reverse that sedation, you give atipamezole. Now selective alpha-2 blockers also have some side effects, including blood pressure, dizziness, headache, sedation, dry mouth, and gastrointestinal disturbances, usually similar like alpha-1 blockers. So this is all about alpha-1. In the next lecture, we will discuss beta blockers. Keep watching the sqadia.com for more such videos in the future.
Introducing sqadia.com on your mobile. Making medical education more accessible than ever. Your one-stop shop for medical learning now fits in your pocket. Visualize, understand, and master as one seamless process. Access exclusive courses on anatomy, physiology, and more, right from your phone. With intuitive navigation and engaging video content, your learning becomes enjoyable and effective. Get started with our free trial. An abundance of educational resources is now just a tap away. Download now the sqadia.com app from Google Play or the Apple App Store. sqadia.com. Medical education at your fingertips.